Medicine has been taught this way for thousands of years. So learn the method, trust the method, because none of you will be the one to change it. This is what was said to me around 15 years ago when I was first introduced to clinical medicine. And in that lecture theater, well, the professor was right in one sense. The way in which we go from symptom to possibility to diagnosis, he certainly aren't its place. Medicine is not built on fashion. Medicine is built on methods that have been challenged, tested, passed down. But yet, when I think back, of that lecture theater, of me sitting in that lecture theater, something wasn't quite right for me. The reality, I was already struggling. Lecture after lecture, exam after exam, I failed. Ultimately, I passed, but I failed again and again and again. And I failed so much that I started questioning, was the problem me? Or was it the way I was being taught? And see, that question matters, because in medical education, the outcome doesn't just stay in the exam hall, it follows the clinician to the bedside. Research from Harvard has shown that there is a correlation between exam grades and patient outcomes, particularly physicians that scored in the first quartile of their board certification exams had the meaningfully lower patient mortality when compared to those in the lower quartile of the same examination. And see, the situation is that the exams that predict the best doctors aren't the ones that are focusing on speed and memorization. They're the ones that are checking for understanding, for reasoning. Yet, so much of how we teach medicine is actually focused on, learn more, move faster, cram the question bank. And yet, I wonder if the question is actually uncomfortable. What if some students are failing, not because they can't think, but because they're being forced and taught in a way that prioritizes recall? And so think about this. Think about a scenario. You have a junior doctor somewhere in a hospital, perhaps in London, it could be me. And a patient comes in, and the patient is short of breath. Their heart is racing. Yet, the blood tests are normal. The ECG, the heart rate, is actually normal. But the patient is still struggling, still short of breath, still not quite right. What will you do? Well, if you've learned to memorize and to optimize for speed, you're looking for a pattern. But what if the pattern isn't there? Whereas if you've learned to reason, you start actually living with the uncertainty, and you're able to think systematically and ask yourself the most important question in medicine, what am I missing? Well, this because the patient actually doesn't come with the pattern mentioned in the book. The patient doesn't arrive with the chapter attached. And so, I started wondering, what else, is going on here that could be, that we could optimize? And well, it turns out this is really, really interesting, because we've actually known the answer of how to teach for understanding for decades. Decades is not new. This is not new. In 1994, psychologist Benjamin Bloom ran a simple experiment, very simple. We take students, we'll give them a one-to-one tutor. The tutor that will adapt to their learning, that will ask them specific questions, that will probe them when they're struggling, and we'll see what happens. Well, the results? Extraordinary. Students that were taught with personal tutors, in this experiment, performed 2 standard deviations better when compared to peers in their classroom-based testing. And yet, you can see a simple problem with this. Obviously, if you give one-to-one tutoring and expert teaching to a student, they will perform better. That's somewhat obvious. Yet, there is a problem. How do we do that at scale? Well, you need pretty much individualized teaching for every single student. That is not really economically possible. It's not really viable. And so, I think we should actually perhaps take a step back and wonder, what was Bloom's tutoring actually doing? Well, Bloom's tutoring wasn't giving better notes, the tutors weren't handing out answers. They were probing more. They were asking why. They were asking the learner to explain their reasoning for how they got to the answer. They were probing the learner when the learner was stuck. They were asking the question in a different way when the learner perhaps wasn't quite getting it in the standard way. The reality is that a good tutor asks questions. A good tutor doesn't give you the answer, it makes you think of how to get to the answer. And this is where deep learning occurs. And deep learning equals reasoning. This is something that actually, again, is not a new concept. Socrates said it thousands of years ago. What Bloom's tutoring was optimized for was dialogue, was the question that were asked during the conversation. What else could it be? What could the answer be? What have you ruled out? What would make you change your mind? Are you sure about what you're talking about? Well, the reality is that, again, all these things are obvious, and yet we didn't really have an answer for this. And so, for so long, we've known that Socrates said it. Bloom, 40 years ago, essentially proved it. But we haven't really done much with it until now. Technology finally allows for us to build systems that not only give better answers, but that ask targeted, better questions. Systems optimized for the student, optimized for their way of thinking, optimized for their learning. I believe that AI systems, particularly when grounded in the curriculum that the students are meant to learn, can be a significant power to help students, not only to understand the basics, but to go over that and to master the concepts that they are taught. And so, in fact, research is very promising in this regard. A 2024 UK random RCT in UK classrooms essentially proven that actually students that had AI-led Socratic tutoring not only performed better than the ones that didn't, but they were better at solving problems they'd never seen before. Now, remember what I was talking about? That pattern, that new problem, that patient that doesn't fit the pattern. That's what we need in medicine. We need clinicians that can get the understanding and apply it to novel situations. Every patient is different. Every scenario is not the same. And so imagine a future where we're present. But imagine a scenario where students, clinicians, they are empowered with a tutor that is grounded in their own curriculum, perhaps designed with the institutions where they work at. Perhaps imagine clinicians that maybe, it's not that they don't quite get it, they just need the question asked in a different way. Imagine clinicians that aren't actually forced to see medicine as page after page after page to memorize, but can see medicine as something that they can practice once the page is no longer in front of them. And so, look, I'm not saying that AI will make learning or teaching easy. That would be false. That would be obviously untrue. But I am certainly saying that AI can make better learning available to everyone. Medicine has been taught this way for thousands of years. So learn the method and trust the method, because none of you will be the one to change it. And well, my professor was right. Discipline matters and knowledge matters. Structure matters and systems matter. But maybe the next revolution in medicine will not be a new drug. Maybe it will not be a new hospital. Maybe it will not be a new form of therapy. Maybe it will actually start with a student that is struggling. Maybe it will start with a junior doctor that doesn't know what to do next. Maybe it will start with a learner that was never incapable, that failed a lot of exams, but that just needed a question asked in a different way. And so, certainly the professor was right. The way we've been practicing medicine perhaps doesn't really have to change, but the way in which we learn medicine can. Thank you.